Postintensive care syndrome, or PICS, is a collection of physical, cognitive, and mental health impairments that can affect patients after surviving a critical illness and intensive care unit (ICU) stay. Over the past decades, advances in ICU care have saved more lives, but many survivors face ongoing challenges such as muscle weakness, memory issues, and anxiety or depression. These complications can make it difficult for patients to return to their normal lives, impacting both their independence and quality of life. Recognizing this, researchers have focused on ways to prevent or reduce the effects of PICS, with early rehabilitation emerging as a promising strategy. But how effective is early rehabilitation in truly preventing PICS? Let's explore the evidence. Systematic review and meta-analysis examine whether starting rehabilitation early, within the first week of ICU admission, could help prevent PICS in adults with critical illness. Researchers analyzed 6 randomized controlled trials, including over 700 patients, comparing early rehabilitation to standard care or no early rehab. The primary focus was on short-term outcomes during hospitalization, such as physical strength, cognitive function, and mental health. Results showed that early rehabilitation significantly improved short-term physical outcomes. Patients had better muscle strength and a lower risk of ICU-acquired weakness. However, there was no significant difference in cognitive outcomes, like delirium-free days, or in mental health measures, such as anxiety and depression scores, between the early rehab and control groups. When it comes to long-term outcomes, such as overall quality of life after leaving the hospital, early rehabilitation did not show significant benefits compared to standard care. Studies reviewed also had some limitations. The number of patients was relatively small, and there was variation in how and when rehabilitation was started. Additionally, not all aspects of PICS were measured after hospital discharge, and some studies lacked detailed data on potential adverse effects. Despite these challenges, the research highlights that while early rehabilitation can help improve physical function in the short term, its impact on long-term recovery and mental or cognitive health remains uncertain. More large-scale, high-quality studies are needed to fully understand the benefits and best practices for early rehabilitation in ICU survivors. Summary: early rehabilitation in the ICU appears to offer clear short-term physical benefits for patients recovering from critical illness, such as improved muscle strength and reduced risk of ICU-acquired weakness. However, its effects on cognitive and mental health, as well as long-term quality of life, are less certain. The evidence suggests that while early rehab is a valuable component of ICU care, it is not a complete solution for preventing PICS. Ongoing research and larger, more rigorous trials are essential to determine how best to support ICU survivors in regaining their health and independence. As the field evolves, integrating early rehabilitation with other supportive measures may offer the most promise for improving outcomes after critical illness.